Welcome. If you've ever struggled to fall asleep, stay asleep, or wake up feeling rested, you're not alone. Insomnia is a widespread issue, affecting a significant portion of adults at some point in their lives. Estimates suggest that anywhere from 1 in 20 to 1 in 10 adults experience insomnia, with nearly 90% of adults facing sleep struggles at some point. But the good news is it doesn't have to be a constant battle. This video will guide you through practical, evidence-based strategies to overcome insomnia, drawing on principles of sleep hygiene and cognitive behavioral therapy for insomnia, or CBT-I, as discussed on the Drive podcast with Peter Attia featuring Dr. Ashley Mason. Let's start with the cornerstone of healthy sleep, a consistent wake-up time. Our bodies operate on an internal 24-hour clock called the circadian rhythm. Maintaining a regular wake schedule, even on weekends, helps to synchronize this internal clock, making it easier to fall asleep at night and feel alert during the day. Think of your wake-up time as an anchor for your entire day. Use an alarm if necessary and resist the urge to linger in bed for extended periods after waking up. Getting natural light exposure soon after waking can further strengthen your sleep-wake cycle. Remember, you can set a consistent wake-up time, which is a crucial first step in regulating your sleep. Next, let's talk about caffeine. This common stimulant can significantly disrupt your sleep. Caffeine has a half-life of around 4 to 6 hours in most people. This means that even if you have your last cup of coffee at 2 p.m., several hours later, a significant amount of caffeine is still in your system. Dr. Mason recommends cutting off caffeine intake, including caffeinated coffee and even decaffeinated coffee, by 11 a.m. for most people. Interestingly, decaf coffee can contain a surprising amount of caffeine, with some data suggesting it could be 15 to 30% of regular coffee content. Avoid making drastic changes to your caffeine habits all at once. Instead, focus on the timing of your consumption. While alcohol might initially induce drowsiness, it often leads to disrupted and poor quality sleep later in the night. Alcohol interferes with the normal sleep architecture, meaning you might not get enough of the restorative stages of sleep. If you are serious about improving your sleep, consider limiting or avoiding alcohol, especially during this initial phase. If you do choose to drink, do so earlier in the evening, ideally at least 3 hours before your intended bedtime. Consistency is key here. The timing of your meals can also impact your sleep. Eating a large meal too close to bedtime can make it harder to fall asleep as your body is focused on digestion. Dr. Mason generally advises patients to avoid eating within 3 hours of going to bed. If you need a late-night snack, opt for something light and easily digestible. The glow from our electronic devices, smartphones, tablets, laptops, emits blue light, which can interfere with sleep. Blue light suppresses the release of melatonin, a hormone that signals your body it's time to sleep. To mitigate this, try to reduce screen time in the 1 to 2 hours before bed. If you must use screens, consider enabling blue light filters on your devices or wearing blue light blocking glasses. Look for wraparound glasses for maximum effect. However, remember that simply blocking blue light might not be sufficient if you're still engaging in mentally stimulating activities like checking email right before bed. Passive activities like watching a non-engaging TV show might be less disruptive for some. Experiment and track what works for you. Many people find their minds racing with worries as soon as their head hits the pillow. A powerful technique from CBT-I to address this is scheduled worry time. Set aside a specific time each day, perhaps for 30 to 60 minutes, to actively think about and process your concerns. Treat this like an important appointment. Make time for it. During this time, you can write down your worries or actively brainstorm solutions. Throughout the rest of the day, when worries pop up, acknowledge them, but gently remind yourself that you have scheduled time to address them later. This can help to unclutter your mind and prevent worries from demanding your attention in the middle of the night. Remember, you have scheduled time to deal with important thoughts, so you don't need to engage with them when you're trying to sleep. This technique can be valuable even if you don't have insomnia. All medications can have circadian effects, meaning they can influence your body's natural rhythms. It's crucial to take your medications at the same time every day and at the right time of day for your sleep. Review all your medications, including over-the-counter drugs and supplements, with your doctor or pharmacist to determine the optimal timing for each. For example, taking a stimulating medication like bupropion right before bed is likely to interfere with sleep. Consistency in medication timing is a simple yet often overlooked aspect of sleep hygiene. Regular physical activity is generally beneficial for sleep. However, the timing and intensity of your exercise can matter. For some individuals, intense exercise too close to bedtime can be stimulating and make it harder to fall asleep. Your heart rate needs to lower to prepare for sleep. If your heart rate is still elevated from a late-night workout, it can be counterproductive. Pay attention to how your body responds to exercise at different times of the day. If possible, aim to schedule more vigorous workouts earlier in the day. Calmer activities like yoga or stretching might be more suitable closer to bedtime for some people. Consider your own fitness level as well. Someone less fit might take longer to recover from intense evening exercise. A sleep diary is an invaluable tool for understanding your individual sleep patterns and tracking the effectiveness of different interventions. For at least a week, diligently record information such as the time you go to bed, estimated time you fall asleep, any nighttime awakenings, your final wake-up time, the time you get out of bed, daytime naps, and your consumption of caffeine, alcohol, and large meals, as well as the timing of exercise. Also note your mood and energy levels throughout the day. This detailed record can help you identify patterns and understand how different factors influence your sleep. You can find sleep diary templates online or in resources like the book Quiet Your Mind and Get to Sleep by Carney, Manbur, and Bootsin, which Dr. Mason recommends. Share your sleep diary with your healthcare providers to give them a clearer picture of your sleep habits. Beyond sleep hygiene, CBT-I is a highly effective treatment for chronic insomnia. It focuses on the interplay between your thoughts, feelings, and behaviors related to sleep. Two core components of CBT-I are stimulus control and time in bed restriction. Stimulus control aims to reassociate your bed with sleep by avoiding activities like reading, watching TV, or working in bed. Time in bed restriction involves limiting the amount of time you spend in bed to more closely match the time you are actually sleeping, thereby increasing sleep pressure. The cognitive part of CBT-I involves addressing negative and dysfunctional thoughts about sleep. Techniques like cognitive restructuring help you challenge and reframe these thoughts. For example, if you find yourself thinking, "I'll never get a good night's sleep," CBT-I helps you examine the evidence for and against this thought and develop a more balanced perspective. Another helpful cognitive tool is tracking the degree of belief in a thought throughout the day. You might find that a worry that feels overwhelming at 1 a.m. holds much less weight by 3 p.m., illustrating that these nighttime thoughts aren't necessarily true. Scheduled worry time, which we discussed earlier, also falls under the cognitive aspect of CBT-I. Relaxation techniques are often incorporated into CBT-I to help reduce tension and prepare the body for sleep. Progressive muscle relaxation, where you systematically tense and release different muscle groups, is one such technique. While mindfulness-based practices can be beneficial for overall well-being, research suggests that they don't necessarily provide a significant additional improvement in sleep outcomes when combined with core CBT-I techniques. While a short nap might seem appealing when you're sleep deprived, long or frequent naps can actually reduce your sleep pressure, making it harder to fall asleep at your regular bedtime. Sleep pressure, also known as sleep homeostasis, builds up throughout the day, signaling your body's need for sleep. Napping can deflate this balloon of sleep pressure. For individuals with insomnia, it's often recommended to eliminate daytime naps, at least initially, to consolidate nighttime sleep. Of course, if you are sick, needing a nap is different. If you do nap, maintain stimulus control by only napping in bed. Melatonin is a popular sleep supplement, often thought of as a natural sleep aid. However, Dr. Mason offers a nuanced perspective. Melatonin is more like the starter pistol for sleep, signaling when it's time to begin, rather than something that helps you stay asleep. In many countries, melatonin is a regulated prescription medication. Furthermore, The quality and dosage of over-the-counter melatonin supplements can vary significantly. Dr. Mason generally recommends that her patients discontinue all sleep supplements, including melatonin during CBT-I treatment, to get a clearer picture of their body's natural sleep patterns. If you wish to reintroduce them after successful treatment, that's a different conversation. Many people struggling with insomnia turn to sleep medications such as benzodiazepines, non-benzodiazepines, and over-the-counter options. While these medications can provide temporary relief, they can also lead to dependence and side effects. Dr. Mason emphasizes the importance of tapering off sleep medications slowly and under the guidance of a prescribing physician, ideally in conjunction with CBT-I. She works closely with prescribing doctors to manage this process, often recommending a very gradual reduction in dosage to minimize withdrawal symptoms and psychological dependence. Consistency is crucial during this tapering process. While CBT-I is highly effective for primary insomnia, some sleep problems might require additional or alternative interventions. Conditions like sleep apnea and restless leg syndrome have distinct underlying mechanisms. If you suspect, you might have one of these conditions. For example, if your partner reports that you snore loudly or gasp for air during sleep, it's essential to consult with a medical professional for proper diagnosis and treatment. Dr. Mason routinely screens her patients for these conditions and refers them to specialists when necessary. For individuals with diagnosed and untreated sleep apnea, consistent use of a CPAP machine is paramount. We want to reiterate the significance of a consistent wake-up time. While you might focus on trying to fall asleep at a specific hour, your body has more control over when you wake up. Establishing a regular wake time helps to anchor your circadian rhythm and sets the stage for better sleep throughout the night. Make this your primary focus. Social jet lag refers to the discrepancy between your weekday and weekend sleep schedules. Sleeping in significantly on weekends can disrupt your circadian rhythm, similar to traveling across time zones. Ideally, you would maintain a consistent sleep-wake schedule, 7 days a week. However, if you do want to adjust your weekend wake time, try to limit the difference to around 30 minutes to an hour to minimize disruption. While formal mindfulness practices may not significantly enhance the effectiveness of core CBT-I for sleep duration, many people find them subjectively helpful for managing stress and improving their overall sense of well-being. Progressive muscle relaxation, a body-based technique, can be considered a form of body scan often found in mindfulness practices and can be a helpful tool before bed. Wearable sleep trackers can provide data about your sleep patterns. However, for individuals with insomnia, an over-focus on this data can sometimes lead to increased anxiety and preoccupation with sleep. Dr. Mason sometimes advises her patients to take a tracker holiday to reduce this anxiety. Focus more on how you feel rather than solely relying on the metrics provided by a device. If you're interested in pursuing CBT-I, it's easier than ever to access qualified therapists, largely due to the rise of telemedicine. Dr. Mason recommends the website for the Society of Behavioral Sleep Medicine, SBSM, as a resource to find certified CBT-I providers. Many CBT-I therapists now offer virtual consultations, making treatment accessible even if you live in a rural area. When seeking a therapist, ask if they offer weekly sessions for a set duration, typically 5 to 8 weeks, and if they utilize sleep diaries to tailor treatment. Be prepared to actively participate in the process. If you have difficulty accessing a CBT-I therapist immediately, the book Quiet Your Mind and Get to Sleep can serve as a valuable self-help resource, guiding you through the principles and techniques of CBT-I. You can work through the exercises and utilize the sleep diary provided in the book. There are also CBT-I apps available, though their effectiveness might vary. The effects of extreme temperature changes, like sauna and cold plunge before bed, can be individual. While some find a sauna before bed subjectively helpful, potentially due to the temperature gradient, it can also increase heart rate, which might be counterproductive for some. It's also important to consider hydration after sauna use, as excessive fluid intake could lead to nighttime awakenings. Cold plunges right before bed are generally not recommended as they can stimulate the body's warming response, which is not conducive to sleep. Dr. Mason's ongoing research is exploring the use of whole-body heating before bed for insomnia, focusing on its potential to aid the body's natural temperature regulation for sleep onset. Pay attention to how your body responds to these practices and adjust accordingly. Overcoming insomnia is achievable for most people by implementing consistent sleep hygiene practices and, when needed, utilizing the powerful tools of CBT-I. Don't wait to prioritize your sleep. As Dr. Mason advises, just do it. You won't regret it. Disclaimer: the information provided in this video is inspired by the Drive podcast by Peter Attia, episode 341, which covers topics that may extend beyond traditional physical therapy practice, focusing primarily on cognitive behavioral therapy for insomnia, CBT-I. Patients are encouraged to listen to the podcast for a deeper understanding of these concepts. Matt Pechacek, PT, cannot be held liable for decisions made based on this information, and this information should not be considered a substitute for medical advice from a qualified healthcare professional. Always consult with your physician or other appropriate healthcare provider for any health concerns or before making any changes to your lifestyle or treatment plan.